much, Madam Deputy Speaker. With regard to the access to GP services, there is a significant challenge that must be met head-on. The solution must address patients' ongoing concerns, involve long-term strategic workforce planning, and must respect and not abuse the GPs themselves. Madam Deputy Speaker, the issue that I wish to focus on is access to NHS Dentistry, which after 18 months retains the unenviable and actually scandalous position as being number one in my postbag. It's quite clear that it's a situation that is repeated by colleagues across the House. Access to NHS Dentistry is a problem that has been brewing for a long time. It can be likened to a house built on shallow and poor foundations, which the earthquake of COVID has led to the house falling down. The impact on people is profound. Millions unable to find a dentist. Thousands in agony resorting to DIY tooth extraction. As yet untold numbers of undiagnosed mouth cancers. Children suffering and having whole mouth replacements. And the poorest hit hardest. The solutions are fivefold. A secure long-term funding stream. A strategic approach to recruitment and retention, replacement of the dysfunctional NHS dental contract, a prevention policy promoting personal oral health care from the cradle to the grave, and transparent and full accountability through the new emerging integrated care systems. To be fair to the government, measures have been put in place to address the crisis. Locally in Lowestoft, funding has been provided to an established dentist to attend to emergencies. The practice have responded heroically and have prevented the system from collapsing. A new long-term NHS contract has been awarded to Lowestoft-based dental design studio. This is welcome, though there is a concern that as it was not possible to commission similar contracts elsewhere in Suffolk and Norfolk, that demand for NHS dentistry across the region will continue to outstrip supply, and the new service could have a very large and unserviceable catchment area. The government's announcement in February of a £50 million dental treatment blitz was welcome, though there is a concern that the take-up of this funding has been limited as dentists have been too overstretched to take on this extra work. In the long term, the fact that the feasibility of establishing a dental school in Norwich is being considered is very much to be welcomed. These initiatives, Madam Deputy Speaker, are a step in the right direction, but the underlying causes of the dentistry crisis are yet to be tackled. In May, the Association of Dental Groups report highlighted the emergence of dental deserts across the country where there is almost no chance of ever seeing an NHS dentist. There is a real risk of them merging to form an area of Sahara proportions. The BDA are concerned that the negotiations to reform the NHS dental contract framework are yet to begin in earnest. Madam Deputy Speaker, I've mentioned the importance of prevention. Back in February, I attended an event in Lowestoft at which Community Dental Services, along with Leading Lives, a Suffolk-based not-for-profit social enterprise, launched a toolkit to help improve the oral health of young people with learning difficulties. Leading on from this, Lowestoft Rising, who promote collaboration between statutory authorities and the voluntary sector, have got together with local councillors and supermarkets to buy toothbrushes and toothpaste for primary school students. The initiative is to be applauded, but the feedback that I have received is that so much more could have been done if they had not had to pay 20% VAT. Surely, Madam Deputy Speaker, this is a Brexit dividend that is looking us right in the eye. As we have seen with the zero rating of women's sanitary products, we now have more flexibility to vary our fiscal regime. If necessary, such a VAT exemption could apply to children's dental products in much the same way as it does for children's shoes. Children's toothpaste and toothbrushes are distinct and different to those products used by adults. Such a strategy would embed good oral health care at an early age and would help prevent those traumatic and expensive whole mouth replacements that hospitals are increasingly having to carry out. Madam Deputy Speaker, such a policy could form part of the new long-term plan for NHS Dentistry that is so badly needed right across the country and which I look forward to the government rolling out at the earliest possible opportunity.